you will have also been sent some questions that we'd like you to take part in a discussion with towards the latter part of the presentation as well. So we're really keen to hear from you and for you to be able to talk to each other and share good practice of what you're doing in those particular areas. Sophia has pressed the record button, I think, so hopefully that's okay with everyone. We'll record this because there are a number of people who are not able to attend this morning, and we will put the recording on our website so that everybody can access it. Where we've tried to share via email, etc., it hasn't worked so well in the past, so we'll put it on the website. So can I introduce us to everyone? So I'm Paula McLaren. I'm the Head of Education and Quality Assurance here at the NMC, and I know many of you. Paula, got two Paulas today as normal.
Hi, apologies. There's quite a lot of Paulas at the NMC. Sorry for the confusion. I'm Paula Holt, and I'm a Senior Nursing Advisor at the Nursing Midwifery Council. And I know a lot of the faces that are on the screen, which is lovely.
Sophia?
Good morning, everyone. My name's Sophia Hunt, and I am the Education Quality Assurance Manager on the NMC team. And I also know a lot of people in this room, so it's really hopefully going to be a nice discussion today.
Yeah, I hope so. Thanks, Sophia and Paula. Just a few, hopefully everyone can see the slides and they're in slideshow format. Now they're not moving on, which is always helpful. Aha. I think they're a bit slow, so just bear with us as we move through the slides. So just a little bit of housekeeping. If everyone can ensure their microphone is muted unless they're speaking. We'd prefer that you didn't use the comment chat box to submit questions. We'd prefer you to do that verbally. But if there is anything that you haven't had time to kind of submit verbally, then do use the chat box and we'll use it to answer any queries later on. It also helps with our development of kind of frequently asked questions for this year's ASR as well. We'll try and address everything. As I say, we're hoping that it's a discussion more than a kind of answering the chat box. We're recording the session, which you all know. And if you're unable to access anything, then you can email the team and hopefully somebody will be able to sort that out. But like I said, we'll be sharing the recording on our website. So just in terms of our agenda, we're going to run you through the timelines for the ASR that we'll be presenting today. We will come on to talk about our plans for annual self-reporting submissions for this year towards the end. We're going to report some of the key highlights and findings that from the submissions and from the analysis of the annual self-report. And we've, as I said earlier, we've asked some key questions that we'd really like to engage in a discussion with you about. This is about you sharing your good practice. So rather than us talking about it, we'd like you to talk about it. And those areas are around the student voice, the collaboration that you have between yourselves and your practice learning partners, student identity and recognizing that we've been through a challenging period during the pandemic and what you're doing and how you're supporting the development of student identity. We're also interested in engagement with people who use services and carers, and also reducing awarding gaps. So really looking forward to that discussion in a little while. So in terms of annual self-reporting timelines, so the ASR obviously relates to the previous academic year. So that year that we're talking about today was from 1st of September 2021, which seems like ages ago, to the 31st of August 2022. So there's a recognition within that we were still probably in the throes, were still in the throes of the pandemic and of COVID, and so some of what we heard was the impact on students of COVID and kind of coming out of that towards the end of 2021. We obviously ask you to submit your ASRs at the end of January, and then one of our colleagues at Mott MacDonald undertakes the analysis, and we get an analysis report back in April 2023, and we have lots of discussion about what's included in that analysis and what kind of decisions we need to take as the NMC following that. So somebody needs to go on mute. Sorry, just a reminder again, if you're not speaking, just to put yourselves on mute there. So as I say, this is the first year that we've done the Sharing Good Practice webinars. We've got 2 separate webinars, one for nursing today and another one for midwifery. So if you've got any midwifery colleagues that would like to join, that's later in July, in a couple of weeks' time, and that will be facilitated by Jackie, Sophia and myself. We'll talk about planning later on. So just a reminder in terms of the purpose of ASR. So you'll know that we programs are given indefinite approval now. So annual self-reporting is one of the key mechanisms that we as the NMC have of gaining assurance. So it is about compliance with our education standards through self-declaration. It allows us to identify any kind of discrepancies between the self-declaration and the report data, and it allows us to identify any risks, but also importantly undertake trend analysis. We also ask about minor modifications to ensure that they're appropriate and that they've been through institutional processes as well. When risks are identified, we want to understand the mitigations and controls that have been put in place and whether these are appropriate. ASR is also an opportunity for us. We use ASR to ensure that you're participating in new program monitoring and enhanced scrutiny. So it's one of those key 6 monthly touch points around new program monitoring and enhanced scrutiny for us. It's also a key opportunity for us to explore specific themes, and these are themes that we'll come on to and talk about in more detail about how we reach these themes, but these are things that we become aware of throughout the year at the NMC, in which we think we'd like to understand a little bit more from AEIs and from program teams about these specific things. It also allows us to identify areas for future monitoring, so where we might see something which we perhaps haven't got enough information on, or we've asked in a particular way but we need a little bit more, we can think about how we're going to do that. But also it allows us to undertake specific pieces of work, so those kinds of areas around protected learning time, that's an area that we as the NMC can commission separate pieces of work which come out of the monitoring. Importantly, it allows us to identify good practice and innovation, and that's why we're here today. So we want to hear from you directly about all the great stuff that you're doing, and for you to be able to share that so that others can start to think about whether that's appropriate for them to use within their programs as well. And really importantly for us, this was the first year that we included NSS scores, and that was really helpful for us to be able to understand some of the feedback that students have been given, but also the actions that you're taking. So key questions, I've kind of talked a little bit about some of those as in the previous slide, but the general compliance questions. So we want to know that minor modifications are appropriate, have been through your processes, and that they shouldn't have been major modifications. I have to say that people are really good in asking us whether it's a major or a minor. So, we'd encourage you to continue to do that and to email us, and we're happy to have conversations around those things. We want to know about programs that are not running or discontinued. And we're also really keen that this is a collaboration, this is a partnership between yourselves and your practice learning partners, employer partners. So we want to know how your practice learning partners are involved in completion of the ASR as well. I mentioned the thematic questions, which we'll come back to. We want to know about external quality assurance as well. It gives us an overall picture of what's going on within the organisation and also within the programme, and whether there's anything that we need to be aware of, which hopefully you will have already told us about. Your current concerns and risks, we want to make sure that we're all on the same page, and then that helps us to understand how we can use our support and influence in some of those areas as well. And we will come on to that in a bit more detail. I've talked about awarding gaps, national student survey scores. We also, this year, we want to know about your future programme development plans. We asked this year about student numbers as well, and that helps us to work with Mott MacDonald to kind of plan for what's coming up as well. So in terms of what we found completing the ASR template, in this reporting period, we had 92 approved education institutions, and just a bit of a breakdown, the majority in England, 12 in Scotland, 6 in Wales, and 2 in Northern Ireland. We spend a lot of time trying to make sure that we give enough information, enough support. We developed what we thought was a robust set of frequently asked questions, and also answer a lot of questions from your teams via email. And it's useful for us to kind of look at the number of AEIs kind of year on year over the past 6 years who were able to provide assurance on their first submission. And I'm pleased to say that the work that we've done in this space through the frequently asked questions and the webinars that we put on in October have meant that we've got an increased number of AEIs who understood the requirements and who gave 100% assurance on first submission. We always get 100% on resubmission, and that's because we keep asking until we get what we're looking for. But it is an improving picture, so that's really helpful. But there's still work for us to do, and you know, one of the questions that we'll ask you later on is how we can support you to make sure that you've got all the right information that you need to complete the template. So in terms of just a couple of key figures, highlights really. So 43 out of 92 AEIs have all approved programs running. And this is probably not a surprise to you. Areas like lack of recruitment, lack of employer interest, concerns around placements, funding, commissioning issues, and lack of demand in some of the kind of post-reg programs, return to practice and prescribing, etc. as well. 19 programs were discontinued, and that was mostly because of kind of outgoing standards. So probably not a surprising picture there. I'm going to hand over to Sophia for the next slide.
Thank you, Paula. So this has been the first time that we've actually looked at and requested from you information about your own internal risk registers and what is worrying you within the NMC approved programs, and what are the key challenges that you are proactively working to mitigate. And so this seemed quite an interesting question for us, and the data that we've gathered from that is hugely important and impactful to our current understanding of the sector and the challenges which you're facing. So thank you so much for sharing this with us. Hopefully the slide is big enough for everybody to see, or they've used the pop-out function to make it bigger if they wish to do so. But if you add up kind of the risks associated with placement capacity, placement quality, practice experience, and then potentially the triple SA there as well, it is a huge proportion of the concerns being faced by the sector are directly linked to placement capacity as well. So we are aware of those issues, of course we are, but actually seeing it in this format is incredibly useful, particularly with the recent news around the workforce plans, and looking to the future there, and the impact of those changes upon placement capacity and associated planning. The other kind of key sector that segment of the pie chart there that really jumps out at ourselves as a team is that academic resourcing. And we are aware, because we've worked with a number of our AEIs around the challenges of recruiting staff with the right experience in order to join programmes, with all the challenges of perhaps of teaching, assessment and personal tutoring, as well as sometimes coming to the table with obviously those highly contemporary clinical skills. What may be sitting under that academic resourcing as well may be to do with physical estate, space for staffing expansion, and one question we will perhaps look to dig a little deeper with is this also connected to simulated practice learning and the resource intensity for an AEI of delivering simulated practice learning in line with the good practice expectations that we've put out into the sector. Colleagues, anything you'd like to add on there?
Yeah, I would, Sophia, because I think it's really helpful for colleagues to recognise that as we have these risks reported and we analyse them, they don't just sit in a cupboard. So as a senior nurse advisor at the NMC, I spend a lot of time with external people talking about what your world looks like, and these are real issues that we are talking about in our support and influence space. Whenever we talk to government, when we're talking with the Council of Deans, when we're talking with whether it's DHSC or NHSE or the equivalent in the devolved nations. So this whole issue around placements, placement quality, practice experience, there is something we'll talk about later about how we share that responsibility more with our practice partners and what support we can elicit. But I think it's just really important to know that even areas like academic resource, we are flagging quite clearly to government. And in fact, one of the things that came up in the long-term workforce plan was that we in our support and influence space had been quite vociferous about the fact that the reason that there wasn't more simulated practice being taken up was because of the resourcing of it, both in infrastructure and in an academic support to it. So it's just reassurance that these are not just things that we report and analyse. There are things that really inform in our support and influence space what we are doing, with external agents in terms of representing your voice.
Thank you. For some reason, Paula, the presentation's gone a little bit awry there. So if you could get us back to where we need to be, thank you. And so we actually collected student number data this year, and we've looked at that in terms of satellite site delivery, as well as in terms of overall student numbers on programmes, and looking across the pre-registration and the post-registration NMC approved programmes. We actually had 116,079 students reported during this ASR period, understanding the some of those programmes perhaps being shorter in duration, such as return to practice and prescribing, as well as the larger pre-registration courses. And actually that data has been incredibly useful, valuable and informative for us. So that will certainly be something we continue to collect, and may look at drilling down that data further into apprenticeships, non-apprenticeship programmes, master's level delivery, etc. in the future. but this slide here represents actually where we've asked you to anticipate forward, where your programs are going, what the direction of travel is for your program in terms of growth or indeed decreases. So the colours on here are quite similar, so apologies for that if it causes any difficulties in interpretation of this slide. There is quite overwhelmingly increases planned within nursing programs in particular, or roughly staying the same, which is understandable given, you know, the challenges that we've reflected on the previous slide. It is quite difficult within the data to be directly comparable between programs. For example, within nursing, we know there is some master's routes where people will be looking to increase their student numbers, whereas on a direct entry BSc or apprenticeship program, they may have looked to keep them the same. Just in case you're trying to tot up the totals, AEIs have interpreted differently how they present their data and information to us. So that is something that we'll perhaps look to standardise moving forwards. But overall, you know, it is incredibly useful to have that data to see where people are anticipating the changes within their programmes. However, we understand that that may, over the coming weeks, months and years, again, look to change. Nobody's signed themselves up to anything definitive on that one. Colleagues, any comments, or shall we move on to the next slide? Thank you. Any comments? Okay, so every year at the NMC, we go through quite a long process. So we're starting it now, obviously, for the next ASR period of engagement activity in order to understand and to formulate the thematic questions that we're going to put together for that reporting period. And that is led by the Quality Assurance Board, and a subgroup of that will meet on a really regular basis to refine and hone these questions. There are some areas which continue to be of huge importance to the NMC's ethos, role and values internally, and those are related to equality, diversity and inclusion. Sorry, merging words there. And of course, people who use services and their carers, and how they are continuing to influence co-production, education, training and evaluation of programs as well. So in terms of the formulation of the thematic questions, we've really focused or tried to focus on impact. And perhaps a new area there is responding to the changing needs of students. So we have asked on a per programme basis, what has been the biggest and perhaps most impactful change that you've needed to make in response to feedback from students? That will be a question we perhaps look to keep, but we're going to review how we do that, because we noticed there was quite a repetition, particularly with the pre-registration BSc programmes, with the NSS action plans as well. So we're going to look at how we make that a little bit more fit for purpose, so that you don't feel you're being repetitive in the information you provide. And obviously we don't have that degree of repetition in the analysis either. A huge focus on the undertaking of simulated practice learning and understanding what that means in terms of hours, etc. And my colleague Paula is going to follow up on that in a few moments. We wanted to look at the pre-registration nursing fields, and very specifically with that question, we were trying to look at field identity and how a mental health nurse, a learning disabilities nursing student, develops that field specific identity. Now, unfortunately, with some responses, that got confused with the issue of actually cross field teaching and learning and cross-field exposure. So that is another area of learning for us and something we will continue to unpick. And then for midwifery, again, we customised the forms this year to each AEI, so you were only being asked questions which were relevant to your provision, was to look at that continuity of carer in midwifery and how the standards related to that were still being achieved within the post-Ockenden space when a lot of continuity of carer models were being changed, but that will be picked up in more depth during the midwifery webinar. So before I hand over to Paula Holt, is there anything colleagues would like to add to these slides?
Thanks so much for that. That's really helpful, Sophia. So we have got sort of areas for discussion, but there's just a couple of sort of preamble slides before we go through this. So we've asked about people who use services and carers. First of all, can I apologise for the continual change of language? We talk about service using carers, we talk about experts by experience. There isn't really one catch-all term. The reason we've put people who use services and carers in this is because that's what our mock colleagues used in the report, so we've kind of stuck with that. But it's been quite helpful to have a look at that again. I think what we've sort of seen through the responses to the thematic questions is there is now increasing involvement of those who use our services and healthcare services and their carers being involved in learning and teaching activity, which is great. And interestingly, within the responses about this, there was a lot of narrative from yourselves about the development of authenticity of experiences when service users and carers are involved. There was work around compassionate leadership being done by some universities where the people who use our services and their carers are included. There was a lot more emphasis on partnership working and co-production, and also the ability of those who use our services and their carers of enhancing student reflection and getting feedback. And of course, that's really, really helpful when we look at once students have qualified and they've registered, they're going to be encouraged to elicit feedback from people that they care for as part of revalidation. So getting this experience of asking service users and carers within the learning environment to give feedback to students has been proving really, really helpful. So what we did notice is that a lot of the responses that we got to this question around the engagement of people who use our services and their carers within both the development and the delivery of our programs is most of that was in pre-registration nursing programs. There was less comment about that in other programs. Now, this might be because there is less involvement in the programs, or it might just be a feature of reporting. Very often the official correspondent may not have the same insight into all the programs across the nursing offer. So it's probably helpful to bear that in mind, that we do get input as well for the other programs apart from just pre-registration in terms of the involvement of people who use our services and their carers. We also picked out a lot of growing areas of good practice and increasing the and increasing in terms of the good practice itself. There's a lot more now. We've always seen service users and carers being involved in things like recruitment and selection, but we're now seeing them supporting recruitment of academic staff, being involved in theoretical assessments and OSCEs more, and sitting on fitness to practice panels. And I'm sure that, you know, across universities, there's more of those areas of good practice that we can pull out when we have our discussion later on in the presentation. So that's sort of the narrative bit. And I think the next slide is kind of a bit more, in terms of the estimated percentage of programs that are citing the range of people who use our services and their carers in the delivery of programs in 21-22. Now, as you can see, for areas like nursing associate and nursing, we have got kind of 100% there that are saying that they've got service users and carers engaged in the learning and teaching on their programs. So it's worth just having a quick look at that just to see how that varies across programs. It's really interesting that Nursing Associate, which is obviously one of the later programs that many of you have been offering in England, has got such a high proportion of their programmes that are strongly engaged with service users and carers. Nursing, again, quite high, particularly in terms of recruitment and learning and teaching. Ditto midwifery. And then, as you can see, it sort of comes down a little bit when we're looking at post-registration. Again, I wonder whether that is an actual reflection of our post-registration programmes, or it's about how it's reported. And that's possibly worth reflecting on when we think about how who contributes to the ASR and who checks that over in terms of the programme leads from all of the different programmes before that's put in, just to check that it is reflecting across all the programmes what that looks like. So that's interesting to see. So if we go on to the next slide. It was really interesting in this report, and as Paula said at the beginning, the timing of the report at sort of the tail end towards the end of the COVID period. It was a time when we saw a lot of comments about how we're responding to the changing needs of students. There was a huge change to the way that we taught and engaged with our students over the period of COVID. And this report reflects that, trying to get back to normal, if you like, or should I say the new normal, because I don't think things will ever be the same again, particularly in terms of pedagogy, in terms of how and where we teach students, in terms of simulated practice. But this was something that was commented on quite a lot, particularly in how that transition out of the COVID pandemic sort of era, if you like, happened. And what we saw was an improvement in placement access, because that had been a significant issue during the period of the pandemic. We saw that move again to more of the universities reducing the amount of online content and beginning to do a lot more face-to-face, which is great. In saying that, there was a lot of, and this continues, a lot of emphasis on work pressures, particularly in how all the accommodations that you've had to make during and post the pandemic to adjust study times, to adjust the assessment schedules, to make accommodations for students. So there was a lot of work pressure that was reflected in terms of the academic workforce and what that meant in terms of making these responses to what students required at the end of the COVID. But interestingly, we started to see at the end of this period, as well as reporting period, a lot more emphasis in terms of cost of living pressures. And it has to be said that that is a narrative, I suspect, during this next ASR that's going to be quite strong. We're seeing a lot of reports and narrative that we're hearing, and it was evident in this report, about students having real cost of living issues and pressures, requesting placements closer to home, being quite pleased that some of their lectures have been online or through a blended method, using simulated practice learning has been really helpful. And I think that that's going to continue to be a narrative. And just to add that in our support and influence space at the Nursing Midwifery Council, we're very much voicing the real issues that students are having in terms of cost of living. We are hearing stories of students who can't go to placement because they haven't got cash to park, because obviously it's taking time for them to get their money back for parking, and a lot more use of the hardship funds within universities as well by students that are in these programs. So that was something that came through quite strong. But there was quite a strong narrative, which was really pleasing to see, and it probably reflected quite a lot of the feedback within the NSS as well, about that need to improve student identity and belonging. Some of that was post the impact of students feeling isolated when they were learning online and really wanting to be back together and learn together. Some of that was about people feeling that their identity in terms of their fields had been eroded or was being eroded, and they really needed to feel that. But there was quite a lot of narrative in the report about what you're doing to improve student identity and belonging. And we're going to pick this up within the discussion later, because I think it's going to be really helpful for us to hear more of that. But I think that need to improve student identity did come, yes, from asking the question, but it was something that was quite strong in the NSS from the year before, as well as this particular reporting year, in terms of students wanting to feel that identity again. There was quite a lot as well in there about increasing the student voice and face-to-face teaching, again, post-COVID. and a narrative around supporting extracurricular activity, whether that was nursing societies or other things, to help students to feel that they were back at university and having a university experience. That was quite important post-COVID as well. So the changing needs of the student post-COVID, there was quite a lot of articulation of what universities were doing to try and support students to make that change back into university teaching, if you like, and university engagement. So if we go to the next slide, the equality, diversity, inclusion. So there was some comments and lots of tables, and there was a lot of variance in the amount of response that we got in terms of awarding gaps. Some are still referring to the old term of differential attainment or attainment gaps, but of course we're talking about awarding gaps and action plans. So some universities were sending in their whole action plan in terms of how they're addressing awarding gaps, and some were just sort of referencing where they were on the journey in terms of identifying and planning to close awarding gaps for different protected characteristics. So, for example, at some AEIs, we had reports that talked about how awarding gaps are being addressed in terms of black and white students, for example, and then we had others that talked about those with and without disabilities, and some only talked about 1, 2, or 3 different protected characteristics. So that was interesting to see the different stages that universities are at. Just to add as well, one of the things that we're trying to be more data driven, and one of the things that we are doing at the moment is we're trying to get hold of and analyse HESA data, so that we will already have a lot of the data around some of the things that you're already reporting to HESA, which hopefully will stop some of the replication. But I'm just letting you know that is on the radar, and that will be really helpful when we get to that point. So what we did note that was 67% of AEIs in England did report awarding gaps and that they were being monitored. We actually saw less reporting of that across Scotland, Wales and Northern Ireland. Now, I'm not sure whether that is something that is about the way that awarding gaps are being managed in the devolved countries, but it'd be really interesting to understand that when we get onto the discussion. And most were monitoring ethnicity and not other protected characteristics. So this is an emerging data set and an emerging picture around awarding gaps that we'll continue to monitor. But I think that what we'll have to do is nuance the questions so that they're more specific, so that we're having more specific answers, because at the moment the variability in terms of the reporting around awarding gaps is quite large. So what we have seen in those action plans that have been put together to address awarding gaps are management through the way that the curriculum is designed and developed, how we've supported access to higher education and how you have been doing that, how you've been providing academic and pastoral support to address awarding gaps, ostensibly by working closer with those people who you want to support to achieve more successful outcomes from their study. And we've also had seen a few reports in the action plans of having more service user and care involvement in terms of the awareness of equality, diversity, inclusion, and how that is feeding through into supporting awarding gaps as well. So that's just a little bit on EDI, and again, hopefully we'll get to discuss that as we go forward. So going to the next slide. So this has been quite obviously a big topic over the past year around simulated practice learning. So it has to be said that the first thing to say is that the outcomes, I'll start with the understanding of simulated practice learning. We still feel that despite the fact we've had lots of webinars and we've got supporting information on the website, that there's still some misunderstanding about what constitutes simulated practice learning. Now, as we said in the last webinar, the number one question is this practice learning? And then it's being simulated. So it has to be able to support, to be able to fulfill all the expectations and the regulation, if you like, around practice learning, but it's being simulated. So looking at the stats for that, we had around about 30% of universities, AEIs, that were using slightly more simulated practice learning than at approval, largely through use of RN5 and RN6, which were the emergency standards that allowed increased use of simulated practice during the pandemic. If we look at the breakdown for that, the ones using more simulated practice learning, 30 of those universities are in England, 4 in Scotland and 1 in Wales. So the outcomes of the effectiveness, if you like, of practice learning that's delivered through simulation are still not clear. However, because those universities approved to deliver up to 600 hours of simulated practice before the revised standard, those that did it through RN6, they are sending in 3 monthly reports, which have been really, really helpful. What we're learning from those reports is that how simulated practice learning is being shaped in response to feedback from students, and feedback from practice has been really, really effective. We're also being able to see which of those AEIs are really understanding what practice learning delivered through simulation looks like, and those that are still unclear. So simulation isn't necessarily practice learning. The other thing to say is that we triangulate what we're seeing in the evaluations and in what you've put in the ASR with what we hear from students, and we have got a piece on student voice later. We do get a lot of comments, feedback and queries from students around simulated practice learning through different media, sometimes through the QA, but sometimes through the education and standards box that we have at the NMC that takes queries. And we do have students saying, you know, I spent 3 hours online and I was doing a crossword and I was watching a video, and I've been told this is part of my simulated practice learning hours. Is it? So we can actually talk then about how it was contextualized or not, and if it did constitute that. So it's really interesting that there are still some AEIs that need to really have clarity around what simulated practice learning is. And although the use of simulated practice in terms of the research is still unclear, the trend that we're seeing in the reports and research so far is suggesting that practice learning delivered through simulation is really, really helpful and effective in supporting learning in slower time, that allows reflection, that is high quality. And interestingly, the comment that's come through in a lot of reports is it's permitting students to have an equitable experience of practice learning because they are having the same experience of learning particular proficiencies and skills, and that there isn't that variance of what they might experience in the real practice learning setting. So we did see evidence in the reporting of the application of SSSA, but we probably will need more require more detail on that going forward, particularly the role of the practice assessor within the simulated practice learning environment. So we will say here, of course, that if people are wanting to use more simulated practice learning than was agreed at programme approval, they will require a major modification. This is likely to be desktop, but it will be a major modification. So we have some universities that are saying, for example, well, I was already approved to have 600 hours of simulation when I had my initial approval. That might be the case, but that was actually simulation that was approved, not necessarily simulated practice learning that meets the requirements and the standards of practice learning. So there is a bit of a reappraisal going on up and down universities across the country, looking at what actual simulated practice learning is being used and what other simulation, which may constitute, you know, part of the theoretical curriculum, is included as well. Again, we can talk about that when we go on to the discussion. So moving on to the next slide. So this gives you an idea of the number of AEIs by country, with at least one of the routes, one of their programs, using a range of average simulated practice learning hours. Now, it's interesting to see, if you look at the far end of that, those universities offering between 300 and 600 hours are at the sort of, there aren't many doing that. And most of those are in England, 1 in Scotland. So it's really interesting to look at that in terms of how many people are, if you like, making the best of offering more simulated practice learning. Conversations with AEIs tells us that one of the biggest factors restricting that is the resource intensive nature of it, in terms of staffing, in terms of equipment, in terms of costs. Now, those of you that have been astute enough and quick enough to read the long-term workforce plan will notice that simulated practice learning was specifically mentioned as a means of supporting increasing capacity. That's fine, but you need to be reassured that those conversations that certainly that we've had at the NMC have made it clear that simulated practice learning does not come on the cheap. If it's going to be done properly, effectively, in a high quality way, it needs to be funded and supported, and that our universities, AEIs, have not always got the resources, especially when we've had basically no increase in fees over past years, increasingly difficult fiscal environment for universities. So just that debate is being had. So if government want that, as you saw, government are looking at what that cost is going to look like. But again, we can talk about that when we get to the discussion, because I'm sure you'll have views about that yourselves. So if we go on to the next slide. Fields of nursing. So this has been interesting. So as Sophia and Paul have alluded to, we asked a question about how we're ensuring all nursing students achieve the proficiencies and content that's necessary to meet the programme outcomes for each field of nursing. So we had huge variance in the answers to that. And what a lot of people reported was that, well, yes, we are managing to cover all 4 fields in the curriculum. And what the question was really trying to get at, and we need to make this clearer, is whether we were happy that we had that field specific identity within our students and field specific content for our students. We have had many students that have spoken to us or within student listening events that have talked about as a learning disabilities student, as a children's nursing student, I feel that when all fields are together, the exemplars that are given often don't refer to our field. So we feel like we've got a curriculum that is all about adult nursing with little bits added in that refer to our fields now and again, and only 1 or 2 modules that are field specific. So I think it's about us trying to work with you to understand the balance between a curriculum that provides what the Future Nurse Standards intended, which was holistic care from nurses regardless of the field that they're registered in, but maintaining the field specific qualities, competencies and proficiencies that they require to operate in that field of nursing. So I think that's, again, one of the things we'll have more conversations about, and we're really, really interested in talking to you about that. And Nikki, I will pick your question up because that's a really interesting question, but I'll do it if you like when we get onto the discussion bit. But I've noted the question. So so that variance means that we've probably got to be more specific in the questioning, and we've got to really look again. What some people are looking at is when the Future Nurse Standards were first implemented and the curricula were approved, and they've written it in a way that really is holistic and is making sure all fields have that holistic feel. It might be the time 5 years on to then look at, is our curriculum really meeting the field specific needs that we require? Is this the opportunity with the other changes in the standards to look at what modifications might be required? Or have we got the headspace to do that is another question. But that's the fields question, and we can move on and talk about that when we go on to the discussion part. So next slide, please. So we've gone on to the discussion bits. We've got about 40 minutes left, so we can probably manage to get away with at least 8 to 10 minutes on each of these 4 slides, if that's okay. So what I've referred to quite a lot during that discussion was increasingly we hear from students themselves about their experience of their programmes. We also have the NSS results, which we are now seeing at the NMC, and that we obviously included within the ASR within the last report. We popped that in. So I think there's a question about, we at the NMC are having more student listening events that are so insightful. We're learning so much from student experience about the positive things as well as the things that could be improved. But all of those conversations lead to us looking at areas that we can support improvement in and areas that we can learn good practice from. So that led to us asking for a quick discussion today, about 8-10 minutes long, about what you might be doing to enhance or encourage the student voice within your programmes. So this isn't about the answer that we get on the ASR that talks about we have programme reps, we have feedback at the end of modules, we have feedback at the end of the year. It's what else we're doing that really encourages that honest reflection, because as we know, students are often reluctant or reticent to offer feedback because they are concerned about the repercussions, even though we know as academics there wouldn't be any for us. We want to hear that feedback. So it's asking you now for your contributions. So happy for you to put hands up in terms of how you're enhancing the student voice, and also looking at that student identity question and building learning communities, whether that's around fields or whether that's around particular areas of programmes. This is a really important area that we're interested in. So Duncan has offered to kick us off with this one.
Thank you for that. That was a very quick hand up. Just to share a piece of good practice that we use, we have a unit in which we ask the students to write an open letter. So that open letter can be on anything they want to. It has to be tied to service user, carers, input. So we have a day in which service users come in. So they get, it has to be an issue which impacts on care. But it's completely free and open. They can do whatever they like. Sharon Holland, my colleague from adult nursing, who leads it, is extremely passionate about, we want to hear your voice in this, we want you to have a voice. And we've had lots of really interesting ideas that students have brought forward that we then take to our practice partners. So working with cancer screening for transgender people. So there's a gap in the services locally around that. This year I had a student who wrote a very good open letter about religious provision for Islamic colleagues, that they have no provision or reasonable adjustments made during Eid, for instance. So it's a really, we've presented it at some national conferences. So it's really a useful way to give the students kind of a free hand to talk about whatever they want to talk about, but also it has tied into some changes in practice and working with our practice partners.
That's a really useful example, Duncan, of something that's a bit different and that is eliciting those real issues. Thank you for that. And Tom, is it Tom or Thomas? Got your hand up.
I respond to either. Yeah, one of the
Thanks.
things we do. Yeah, one of the things that we do to enhance and encourage student voice within the programme is to ensure that they know there are a number of different people that they can actually raise issues with. We work very, very closely with the Students' Union to ensure that, you know, they don't feel that there's going to be repercussions, but we in fact actually welcome feedback, no matter whether it's good or bad or indifferent, because we in fact actually see the feedback as not being a complaint, but in fact actually an opportunity for us to put things right. But the other thing as well is that there are, you know, always open doors there as well. And we, you know, do encourage that if the student doesn't feel that they can speak, you know, up themselves, that they can go through a rep, they can go through a number of different people, even if it's, you know, when they're out in practice or whatever the case may be. And in terms of, we say, increasing the identity, or, you know, trying to get them to identify, we say, within their own field as well. One of the things that we do is when we're actually teaching, we say what might be considered, you know, a module that applies to all of the students, we will pick out specifics, you know, and we'll just, in fact, actually say, if we're talking about cannulation, we might talk about, you know, cannulation, we say within, we say in an acute setting, we might talk about cannulation, we say in a mental health setting, in ECT or whatever the case may be. So is that, you know, we recognize that there are different groups of learners, but then also that, you know, something like a legal aspect may be very different from we say someone undertaking adult or child or you know mental health, so they actually know that it's important to have that holistic information, that holistic care, but that there would be further requirements of depending on, you know, which program they're undertaking.
Absolutely, yeah, totally agree. So this might be an area going forward where it might be useful to have a longer webinar to talk about student voice, because it's something, as I say, we're really listening to in terms of students that are getting in touch with us. So this might be one to pick up again. Should we move on to the next slide? Because it might be that the other ones are going to elicit a lot more hands and conversation. So one of the things that we picked up in the ASR was there was probably not as much evidence, if you like, of collaboration, certainly in terms of the reporting from our practice learning partners and employer partners. So it was a question about how we involve practice learning partners in the ASR, and whether there are any innovative ways in which you're engaging with partners in this process. So I always used to say, with my dean hat on, that all of these programs are a collaboration between you and your partners, and that they are as responsible for the program as you are. So it's how they're involved in the reporting process back to us. So I'd be very interested in anybody who wants to offer anything in terms of this, either what they do or ideas of how to do it better. So Julie, I think your hand was first up.
Okay, yes, thanks, Paula. I suspect that the governance infrastructure where I work is different to other areas. I work at the Open University, so obviously we have 4 nation relationships with employer and partners. And our infrastructure is different in that we actually have a great deal of governance done at operational level. So we have at least quarterly meetings with all of our partners. And beyond that, we also have frontline tutors that go into practice regularly with students. But I suppose in terms of good practice initiatives, one of the things that we've done during the pandemic, but it's actually changed its focus now as we've moved out of pandemic, is that we actually across all levels of the nursing program, we actually engage in what we call practice assessment interviews collectively with our employers. Now that initiative was put in place to give us greater confidence of student assessment in practice, because it allows us collectively with our partners to look at the evidence base that underpins care. So it's almost like we've introduced mini vivas with employers, but we engage at that now at all levels of the programme. I thought first when we talked about this that this would not be a welcome initiative, both with our partners and with students, but it's been evaluated highly, seen as very, very relevant, non-intimidating with students. They've engaged well. So it's just a way that we've been able to go in and work collaboratively with partners on a regular basis to look at issues affecting students in practice and outcomes.
That's really helpful, Julie. And I suspect there are colleagues around the room nodding their heads saying that they probably do something similar. Sometimes in the ASR, I think it's less about saying we have these regular meetings, blah, blah, and giving some examples or talking about what that really looks like in practice. Because you can hold meetings and that sort of thing. What you've described there is actually what's coming out of that, which is really, really helpful. So Julie Williams, you have your hand up.
Too many Julies as well as Paula's. Just to ask a query, really, this webinar invitation, did it go to placement providers?
No, and we're going to be doing something
wondering
different.
If you could tailor something. Yeah.
I think it needs to be nuanced slightly differently, because there's going to be a lot of the things we've talked about that are really around curriculum that shouldn't be said. But interestingly, you might be aware we have a new director in professional practice in Sam Foster, who is an ex chief nurse, and she is very, very keen that we do more of these sort of events with practice learning partners. Even some of the webinars we've been doing on simulated practice, we should be doing those with our practice partners too. You're absolutely right. So that's definitely on the agenda. So thank you for raising that.
Thank you.
And Mike? Are you there, Mike? Parker? Nope. Okay, no worries. We've got a hand up, but obviously I can't. No, that's fine. No worries. Okay, happy to move on to the next question, because there's going to be. Oh, mic's not working, Mike. Sorry. Do you want us to come back to you? Don't worry. I'll try and fix it. Okay, no problem. We'll come back to you, Mike, as soon as we can. So you're absolutely right. Thank you for that suggestion as well, Julie, around us engaging more with practice learning partners. That's going to be one that's going to be really interesting to see, and might in fact help inform some of our ASR questions going forward. Sarah?
Hi, sorry. I work alongside Mike, so I'm not sure whether or not I can offer something that he might have been feeding back on. It might not be, but I guess we work at University of York, and I then program lead for the Nesson Associate Apprenticeship, and part of what we've done in terms of working alongside our partners in practice is to develop a sorry, just turn that off, it's pinging like mad, is to set up a working group with our partners and the practice education teams within the different organisations, looking at how we can coordinate and embed clinical skills and clinical simulation for within theory and within practice, and looking at how we do that and planning in practice development days that meet our Ofsted and our ESFA funding requirements, but also enhance that opportunity for learners on the programme to be able to use more simulated practice. So that's been a really helpful way of just engaging practice partners.
That's really helpful, Sarah. And interestingly, you probably noticed in the supporting information that we wrote around simulated practice in particular, we are saying that simulated practice happens in all environments, including out there in the practice setting. It's not something that's exclusive to a university setting. So it's really helpful to know you've had those conversations about that. That's great. Thank you so much. So moving on to the next slide, and if Mike does come back and wants to contribute, that's absolutely fine. We've already asked about this, so it's really around people who use services and carer engagement. So we saw that slide that talked about all of the areas that service users and carers, experts by experience, were engaging with, and it's worth knowing if you're doing anything different to what we're seeing, or how we're getting back to pre-pandemic levels of engagement. What's interesting is, during the pandemic, some universities were reporting more engagement because they were doing it like this, virtually, and some were talking about a lot less because it was in person. So I think the other question within this whole sort of question set here, which we'd really like your voice on, is how confident you are that all the fields and programmes include users of services and carers, and that these users of services and carers represent people across all the fields and different programmes, because that's not easy either, particularly in the child field. So I'd be really interested in your thoughts on how what good practice there is in this space of our engagement of services and carers. Any offers? Trudy?
Yeah, I can come in relation to child. So you're right, Paula, it is an area where we sometimes struggle. I've recently moved AEIs, and I'm in a slightly larger city. And in relation to my area, we've made good links with the local youth councils. And so the young people themselves are quite active and quite vociferous in their comments that they make to us sometimes about what they want to see, what kind of nurses they hope to have come out to them. And it's great. So Salford Youth Council have got a group that they call themselves, so it's not that I've named them, they've named themselves. They're called the Nerd Group. and the nerd group are pretty much online like this, do lots of gaming, so we've done lots of interaction with lots of different areas, and the feedback that they've given us in relation to new programme delivery has been excellent. So it's an area that most cities, towns will have. They'll have a youth council on board, so it seems to be working for us for now. So thank you.
That's really helpful, Trudy, to be tapping into existing sort of infrastructures of people that can be supportive. That's really helpful. Any other offers in terms of things you might be doing that are different in terms of trying to engage people more in supporting the development and delivery of your programmes? Mike? Karen, are you there? Karen McCutcheon. Apologies, I'm on mute.
Thank you. So yes, we've been looking at using local charities and local primary schools. We do go out to the secondary school, the older children, a lot, but we've actually started using some of our events with primary school children, and they've become engaged in creating games for dementia NI, for example. They're working with us on creating games and how that can impact on family and stuff. So we do know that children was something that we needed to connect more with. We also have staff champions. So every member of our service user and care forum has a staff champion that works with them to mentor them and sort of do an induction with them to make sure that they know how the school functions, they know how the programs function, and someone they can go to ask questions. And that's been really successful. And we've also actually got 2 members of staff who are service users and carers now, who are on our academic, they're part of our academic faculty, which is fantastic, and we hope to increase the numbers with that as well. So yeah, it is a challenge, but I think if you can line staff up with each member, that will also help to make sure that they're involved in everything within the school.
That's really interesting to hear, and I like that idea of people who are service users and carers actually coming on and being part of the academic team as well. We have got an academic workforce crisis out there, and we're needing people to support as best we can. So if we have got people coming in and they can support that, whether it's visiting lecturers or whatever, that's really, really helpful. That's lovely to hear. Thank you for that. And Paul?
Thanks, Paula. Yeah, so it's interesting to hear what Karen was just saying. We've also employed someone who's a nurse but it also identifies himself as a service user representative and has done a lot of work nationally through the RCN and lots of other organisations. But I would add, I think there's great opportunities there to integrate them into the service user care forum to be able to lead that work. But I would also echo that there are kind of unexpected challenges that I think we're going to be working through for some time in order to support that person and to make them feel kind of part of, integrated with the team, because they don't fit the mold of the other kind of academics that we have, and it's trying to kind of integrate them effectively. The other thing that we're doing, actually, it's useful to be able to plug it, is that we're running a service user carer co-production conference. It's a national conference on the 12th of September. So it's bringing people together from across the sector who are interested in looking how we effectively collaborate in healthcare education. So it's not nursing specific. It's also working with colleagues in psychology, so the arts therapies. It's got a mental health leaning, but it is inclusive of all healthcare education. So if that's okay, I'll drop a link into the chat if anybody wants to register for that. It's a low cost event, and service user carers are also welcome to be represented there.
That's really helpful, Paul, and I know that work that you've been doing has been really helpful in supporting the Annex A proficiencies in particular, which is just great. So thanks for that. And Deborah?
So it's interesting because I think this follows on with what the others have been saying, but we've included in our strategy now for public involvement the use of non-academic staff and students, because we've recognised that a lot of them actually are service users already and have got care responsibilities. So we've included them both within the college and in schools and colleges outside of our College of Nursing. We've also, going back to the pandemic with the online, we've adopted a hybrid approach. So there are still people who struggle to come into the building. So we will allow them to use Collaborate perhaps and stream to all of our classrooms all at the same time so that we can facilitate service user involvement that way as well.
That's really helpful. Many of us wear different hats, don't we? And it just because you're a student doesn't mean that you can't offer something to that forum. So that's really, really helpful. Thank you. And Catherine?
Hi, I'm just going to try not to cough. I work at Sunderland University on the nursing apprenticeship, and I think at Sunderland there's a really big team for patient care and public involvement, and that's been developed over a number of years. So there's there's probably a couple of hundred people on that who are patients, who are carers, who have a wide range of diagnoses, I guess. So in terms of either physical health, mental health, learning disabled people who come and support us on. And I think the plus thing about it is not only do they take part in some of the kind of scenario-based simulation types of sessions where we might need to be able to get feedback about what it's like to be on the other side of the professional, but they are also really heavily involved in developing the sessions in the modules, looking at module review with us in terms of actually, do we need to be thinking again about whether everything on this module is actually helping to prepare the student. But they're also involved in the development of the programs, in the revalidation of programs, in interview for some academics as well, and that kind of broad across all of the programs. And I think we find that a huge strength at Sunderland, that there's this pool really of people that we can pull from, and that we can I guess if we're thinking about specialist things, we can actually individualize depending on what it is that we want to talk about, and what condition we might want to talk about, what experience we might want to talk about, that we can actually really pull from quite a big pool. We're probably quite lucky in that way.
And that's invaluable, having a pool like that you can pull on. The authenticity of the voice for the students is huge, and their participation in things like simulated practice learning is going down really well with students because it's real, it's authentic, and that's really good to hear. You've established that. Not easy, I know. So we've got two quick comments from Sarah, then Alison, because I'm conscious we want to move on to the next slide. Sarah?
Hi, thank you. I guess it's just to introduce a different aspect to it, in the sense of we have, as a department, we have contracts with our, it's called Out with Character acting drama group, and Converge. And what we do is we have a contract set up. We are able to use the actors, the drama group, whether it's within individual sort of simulation or sort of assessment type activities, or whether or not we get them in as an acting group. They're delivering a session for our learners, looking at, I suppose, themes around stigma, discrimination. So they will provide scenarios that engage students, and they're part of sort of redeveloping those scenarios to look at better practice. So all our BSc, Masters and A programs use that resource.
That's helpful to know, and I think there's been that mixture, particularly as we've been developing simulated practice of actors, of experts by experience, service users and carers. It's been interesting to see those developments, and I will comment on that in the next discussion. And then Alison?
Oh, just quickly, I just wanted to highlight our service user population, in that they've actually they actually run and developed a module called Experts by Experience, and they did that in conjunction with ourselves as academics and with our student population, and that's ran for a couple of years now, which is really the students are really engaged with it. The academics are more there for support for the service users, and we have immigration groups, we have children's services, we have a whole breadth of different service users coming in to support that module. But they're very precious about that module now, the service users, because it's theirs. And we're just looking at the new programme that we're developing for next year, embedding that in it's at the moment it's just a generic field module in the first year, so we're looking now at developing it into second and third years, because the service users want to see how students have progressed.
Yeah, absolutely. And isn't it great that they're taking that sort of interest and supporting the learners? That's great.
Yeah, we're really lucky to have such a big service user involvement, from interviewing right through until consolidation events. When students qualify, they go to the qualification ceremonies and celebrations with them. So that's really good. But yeah, I just wanted to highlight the module.
That's grand. So what you're really describing real partnership there in terms of supporting student learning. That's fantastic. And then, are you all right if we go to the final sort of discussion slide, which was around reducing awarding gaps, and then I'll go back to a question that was asked earlier. So obviously, in terms of reducing awarding gaps, we've heard about different frameworks and toolkits, and many of you gave us our action plans. We've heard about different approaches to staff development as well, so that they're more aware of awarding gaps and what our responsibilities are in terms of being mindful of those and supporting change. But is there anything within this space that you'd particularly like to shout about or share? It would be really helpful to hear, because this is really emerging. We've got very different practice across the 4 nations, and it would be really interesting to hear from one of the devolved nations about what is happening there as well, because that was an area that was pretty underreported in the ASR, and it might just be that it's just not been written down. So any comments, please? It's Tom again. Hi, Tom.
Yeah, I think that one of the things is about looking at the type of assessment, because that's often actually where the award comes. And you know, people may not be great whatever essay writers, but they could be great presenters. So it is actually, I think, about looking at the opportunities for the students to play to their strengths and ensuring that this is taken into consideration.
Couldn't agree more. I mean, I always have a rule of thumb that the assessments that we have should be aligned to the proficiencies we expect of our professionals when they register. I'll also, and you can shoot me if you like, but I'm going to reflect on my days in academia and say that we often over-assess as well our student nurses. So, you know, it is a case of looking at what we're doing and not giving ourselves work that we don't require when we are over-assessing or we're assessing particular learning outcomes several times. And I think that, again, for some people, this might be an opportunity to have a look again as we're looking at modifying for other reasons our curriculum with the small changes we've made, to have that look again at how and on how much we are assessing. And, you know, if we're going to be doing modifications over the next year, is this one to look at in the light of what we know in terms of not everybody, but there is quite a bit of over-assessment goes on. So Julie Messenger, then Julie Williams.
Yes, thanks, Paula. Just in terms of awarding gaps, I think for the Open University, many of our initiatives are institutional led rather than simply programme led, and I suspect that that's the same for all of us in higher education. We are, as a university, reviewing the whole issue around assessment workload. I don't think that's going to have a major impact on nursing, because I've always sort of championed for reasonable amounts of assessment. But I suppose the thing I want to report on, and again, it's been an institutional-led initiative, is we are now reviewing the nature of how we present our online materials to ensure that we are fully inclusive of different groups in society. Now that was an initiative that was developed through our EDI leads across the university, but it has had a major impact on how we actually present our materials. And I suppose there's learning for all of us, because whether we are presenting online or whether we're going into classrooms, we can be quite English centric.
Yes.
In terms of how we present, and that naturally, by default, can irritate, exclude other individuals. So, as I said, we are purposefully now reviewing our curriculum to ensure that we are fully inclusive and embracing of people with different protected characteristics.
Absolutely, absolutely. And notice Susan's comment there. And I've also noticed the comment from Paula about we've only got 10 minutes left. And so I'm conscious we want to get a couple of quick comments in, if that's all right. And then there's just a few concluding remarks. So Julie Williams, and then there's a third Julie after that.
Right, just a general comment, really. There's absolutely loads of good ideas here being shared, some of them written down, some of them obviously being verbalised. Will the NMC capture those and potentially give us a document?
So interestingly, Julie, you've kind of preempted one of my comments, which was not going to be really about but the NEC producing a document, but was going to be about how do we bring you together and support you as a community of practice. And it might be that for some of these areas, we bring together a bit of a webinar. We call it webinar. This is obviously just a Teams meeting because it means we can talk to each other, which is more effective. Because what we have done is created a community of practice, for example, around simulated practice learning, where people are now sharing resources, sharing ideas. We are so collaborative in this space. We've got Council of Deans of Health, which means that we collaborate anyway at that level. And we are all in it for the same reason, to produce nurses, midwives and nursing associates that deliver safe, effective, kind care. So sharing and being collaborative is key. So we will certainly take that away, Julie, and look at how we can bring people together and support that sharing. That's a really, really helpful suggestion. And Julie Bailey, Mikhail? Can't hear you, Julie. So Irene Anderson.
Thank you. Just to share, we have funding for a 2-year project, and it's about study skills and academic support, and we're focusing that on people from Black and Asian ethnic minority groups, but specifically within that, looking at people with lower grade point averages, and women with hearing responsibilities, just to try and really drill down to people that would benefit from that support. So that is well underway, and we'll be reporting on that in the next year, and with looking to roll it out further.
Great, that's lovely. Thank you, Irene. And then Teresa, then Nikki. Can't hear Teresa. Is your microphone off, Teresa? Okay, Nikki.
Is that better?
That's better.
There we go. Sorry, everyone. So I think initially the data that we received from a university perspective was program level data, but that doesn't allow you to drill down into your curriculum to look where the issues are. So what we now receive is module level data. And so what that's enabled us to do is to look at all of the modules in our curriculums, to look at how they're delivered, to decolonise the curriculum, to make sure that our student body and the population is represented in our case scenarios and our patient examples or service user examples, but also to look at the assessments and say, okay, well, these modules are doing well, but there's an obvious attainment gap with that module. Look at the assessment, look to see whether that's fully inclusive. And we have reduced our workload across the program, because ultimately I think what we forget in academia, or the university forgets, is our students are assessed in practice alongside the theoretical assessment. So what we've managed to achieve is a greater recognition of that practice element. And then if you think about simulation, there's huge opportunities there to make sure access to everything is equal and there's parity. And so our SIM team and SIM fellows have been also working with industry to ensure we've got mannequins that are very ethnically diverse and very actually realistic, to make sure that if we can't have service users in that particular activity, then we are at least representing the population and service users and our student group. So there's lots of work going on across the university, but certainly in the school I work in, around making sure we meet all those things, and lots of initiatives.
And again, it might be an area where we can collaborate going forward and share these ideas in a little bit of a wider, with more time and space to do that. Quick comment, Nikki, if that's all right, because I'm very conscious of time and we've got a couple of things we just need to cover before we close.
Yeah, sorry, I just wanted to come back to the question that I asked before, which you did say you'd come back to, which was about the proposal to reduce the simulated practice hours. I just wondered where we are with that, how far along, and are we looking at, would the 1,800 hours still include 600 hours of simulated practice learning? Thank you.
Great question. In terms of long-term workforce plan, obviously that's cottoned onto the idea that we've permitted universities to offer up to 600 hours of learning through simulated practice. That's as far as we've got. And as I mentioned before, in that support and influence space, we're making clear to government and others who speak to us that does come at a cost, and that it's not just going to magically happen and 600 hours of placement capacity are going to disappear, because that in terms of the responsibility of practice learning partners. In terms of the future, we have now got a new work package that's going forward in terms of what does the hours look like. Without going into lots of detail, we've done a look at overseas practice learning and the number of hours they do in different countries. It's like comparing apples and pears, because practice learning is different. It's not always about just putting 10 students on a ward and letting people who look after patients supervise and support them. Often in other countries, it's about having somebody that goes out with students and teaches them in practice. So we've got different models. If we were going to do anything in terms of changing hours, that would need evidence and it would need consensus in terms of consultation, and you would all be very much a part of that. We do need to avoid unintended consequences of more of the burden of the education and training of our future workforce being landed with you, with no extra resource in there. So it's a balancing act, and all of that will be taken into consideration in the work packages going forward. Is that all right? Does that explain it ish? But there'll be a lot more to be heard on this that we can discuss. So that's that one. Next slide. So I think it's down to you. Is it Paula or Sophia?
It's back to me. Thank you very much indeed, Paula. So a few quick points really, that the ASR reporting period, we are running those webinars in October, which means we will have finalised obviously all of the questions. So I believe Heather, you asked the question earlier around if it could come out in October. We will look to see how we can facilitate that to enable greater collaboration with the practice learning partners. We will be having I will be having individual meetings with AEIs where they have struggled perhaps year on year with first submission, to perhaps help with some information and guidance there as well. And obviously we will discuss the new thematic questions and what we're looking for within the answers at those particular webinars. Next slide, Paula. Thank you. So our final question really is for you to let us know if there's anything else we can be doing to support you. within the ASR writing and process, and what else you'd like to see from us in terms of kind of sharing good practice, please do get in touch and let us know if this has been a useful session to have today, and of course any feedback about how we could have further improved that. But the email is on the screen there for the team if you have any questions or comments that we can help you with. Thank you very much indeed.
Thank you. And it's much better having this ability to speak to each other as well. So really appreciate you all attending on Teams. So thank you.
Thanks all.
Thank you. Really interesting. Thank you.
Thank you very much. Thank you.